Okay. And good morning and good afternoon, everyone. Thank you so much for joining us today. Today, we will be listening to the Alliance for Responsible Mining about their work on occupational safety and health in the ASGM sector. Today, we have three speakers with us. And before we get started, just a few things. If you have questions, you can pose them in the chat and we'll answer them as we can. All of the materials that we will be talking about today that they've been working on this in the last 4 or 6 months, I can't remember now. These are already on the home base, which everyone should have access to. This is an internal Planet Gold sort of resource library. These are in draft form, so they're not quite ready for circulation. We have posted them on there because we are mentioning them today, so we wanted to make sure that you have access to them, but just please don't circulate them outside of the Planet Gold program. And then once they are ready for circulation, we will notify everyone on the Planet Gold teams. So I think we are ready, and I will hand it over to Yves.
Thank you, Mona, and thank you everyone for being here. My name is Yves Bertrand, and I will introduce quickly the presentation and the work we've been doing. And then I will pass on to Josephine, who will talk more about the scientific research that has been done. So we have been, Alliance for Responsible Mining has been assigned the task to sort of find out what is being done and what is available as resources in ASGM on the topic of health and safety. And we have been working on this on two main aspects. First, what is being done in the science and the research side, and what is being done by practitioners on the field through projects and other initiatives. Next slide, Jennifer, please. So the core team is composed of Josephine Singo, who is a specialist on the occupational health and safety topic in the ASM. Patient Singo, who has extensive knowledge on ASM projects and work in many countries of the world, and myself, Yves Bertrand, who I'm also kind of an old guy in the ASM sector, so I've been working on these topics for more than 20 years. But I want to add the very good collaboration with Juan, who should be around and who managed the whole study in terms of exchange, coordination, quality review of the documents, and also he made some inputs in the writing. And I want also to thank Mona and Susan from NRDC, who did a very, very good job in terms of collaboration and exchange on this during this study. Next slide. So what is behind this quick reference guide? So the objective is to mainly fill a sort of gap that has been identified by Planet Gold, which is what resources are available out there on this difficult topic that many projects face in the ASM sector, which is the occupational health and safety issues. So the idea was to provide first a quick and fast overview and understanding of what are the risks around this in this type of activity, and to make a very extended but quick to overview to look at summary of what are the impacts, what are the priorities in this sector, and what are the typical topics that are neglected, that where we find gaps that are still not addressed. We also made the guide a resource for uh, solutions, techniques, approaches to improve the situation, so that can be these solutions can be used for designing a program. It's not fully extended, but it gives sort of directions to where to look, and focuses on very high priorities. We also have included a full gender-related section on the risks that are experienced by women, or the gap of the gap that we find in the lack of testing and working on these gender-related issues, such as sexual based violence and discrimination in access to the resource, for example. And the quick reference guide is also works also as a guide to dig further into specific topics. So if you want to go more in depth, you will find resources, scientific resources, but also experience from the recent projects that have been tackling such a topic. Next slide, please. So the content is the quick reference guide is composed of mainly 4 parts. First, what are the priority risks in the ASGM sector? And this comes from the main literature review. That means what science is telling us about that. And then we have a second part, which is more what has been produced and available on the internet as training and capacity building material. What do we have as booklets, handbooks, and other training material, and what do they tackle? What do they insist on, and where we can be inspired by this material? And then in a third part, we also took 5 examples that we all know very well and that were positive as implementing OSH programs. So in this analysis, we looked at what what was the approach, how they did it, and what was positive, but also what was negative in this approach. What problems did they face, and what limited the impact of such OSH programs. And the fourth part is a bibliography and other annexes that are quite useful for further research. Yeah. Next slide. So I will pass the floor to Josephine, who will tell us about OSH as looked at by science. Thanks.
Thank you very much, Yves. Welcome to all, and thank you for participating in this session. So in the interest of time, I'll start with my job for this afternoon. So I'm going to present the findings from the scientific literature review we conducted as part of this work. So I'm going to give the overview of occupational safety and health in the ASM sector. This is going to include the existing hazards, the common events, mitigation measures, as well as the management strategies. Next. So I'm going to start with introducing OSH in ASM. Next. So what is OSH? So occupational safety and health is a discipline which focuses on the protection of the safety, and the health of the workers in the workplace. And this is achieved through reducing or preventing workplace injuries and illnesses. And in other contexts, it also includes the protection of the workers' rights, which is rare in national small-scale mining. So from the definition, we can appreciate that OSH is limited in national small-scale mining. Hence, this session is the groundbreaking for the enhancement of OSH national small-scale mining. So what are the challenges? So literature has confirmed that occupational safety and health in small-scale mining is compromised despite the existence of multiple hazards. And the challenges include the nature of the working conditions in small-scale mining, which is unsafe and in most cases not professional. OSH is also challenged because of the informalities which are associated with the ASM. At the same time, there's lack of reliable data. So if you look at the ASM, there's limited data recorded on site. For example, the number of injuries and accidents recorded on site, that data is rare. And at the same time, records on occupational health and safety diseases in ASM at the local healthcare centers is also limited. And one of the challenges with occupational safety and health is compromised effort to improve occupational safety and health. I think we all agree that the news and the reports on injuries in ASM is common. In some contexts, it's common in the rain season. And this is associated only with blame on the sector and limited or no focus on protecting the health and safety of the miners. So the health and safety, there's compromised effort on occupational safety and health according to literature. And literature has also revealed that the gender inequalities in ASM are also evidenced in gendered occupational safety and health issues in the sector, which is presented in our products as the gives is reported. Next. So what are the hazards in national small-scale mining? Literature reveals that there is a multiple hazards which vary from chemical hazards, physical hazards, economic hazards. So we have multiple hazards in the sector. As we can see, these pictures are just showing some of the hazards. However, the report that we have compiled is going to review the multiplicity of hazards in national small-scale mining. And it should be noted that the transitioning to equipment without proper operational procedures is also associated with increased risk for the small-scale miners, as we can see from these pictures. Next. So, according to science, when there is a hazard is existing in any environment, and we have exposure pathways, which could be through inhalation, ingestion, or physical contact, then that hazard can cause a risk. So we have multiple hazards in national small-scale mining, and there are various pathways through which the millions of workers in this sector are exposed to these hazards. So the hazards in national small-scale mining are associated with risks as shown by literature. Next. So what are the occupational safety and health risks in the sector? We have accidents and injuries, and the rate of accidents in small-scale mining is far more than what is experienced in LSM, according to literature. At the same time, we have chemical poisoning coming from being exposed to mercury or cyanide. There is also respiratory diseases such as the tuberculosis, silica, associated with the exposure to dust. In small-scale mining, overcrowding is common. There's poor hygiene, and there's also lack of sanitation infrastructure, which is also associated with the spread of infectious diseases such as the TB, typhoid, and the cholera. It should also be noted that alcohol and drug abuse is common in small-scale mining, and this is also a contributing factor to the number of injuries in the sector, as well as the workplace violence. In addition, we have occurrences of abandoned pits, there's deforestation, poor sanitation, and stagnant water, which is also associated with diseases such as malaria, increasing malaria in small-scale mining. There is also the ergonomic risks, that's not small-scale mining, associated with the confined workspaces, as well as repetitive work and heavy lifting. So literature reviews the figures and numbers of the occupational safety health risks, and these are available in table 2 of the literature review report. For instance, TB, it has been found that TB national small-scale mining is projected at 30% compared to the normal population, and injuries were ranging from 14 to 72%. However, the rates depend on the countries, country by country, and also site by site. However, the findings are shown in the report on literature review in table 2. Next. What are the gendered occupational safety and health issues in ASM? Literature reveals that men are more prone to fatalities and accidents associated with the underground mining collapses. At the same time, women are also exposed to accidents, and partly because access to PPE and training on health and safety is limited among women. Silicosis was found to be 1.8 times more among men compared to women, which could be attributed to the work that is done by men underground and the exposure to underground dust. And HIV, literature has shown that HIV prevalence in ASM is more among women compared to women, and poor sanitation and hygiene as small-scale mining is associated with the lower participation of women in the sector. Next. So this one is to show what you can access in the products that we have from this work. We went beyond just identifying the hazards and risks in the sector. So as you use these resources, you can identify the gendered impacts, the articles, and the recommended mitigation measures. I'm not going to get into detail because of our time. Next. So what are the possible mitigation measures? So these resources, they are also bringing the possible ways of enhancing health and safety as small-scale mining. This one is just an example of how do we improve the safety of the shaft. So ordinarily, a miner could throw down, or they could use a basket, which is being moved up and down manually by other miners who are on the ground. So now we can have the hoist system. Normally, the miners use wood, but if they use metal, it's stronger. It's a mitigating strategy. Then when it comes to the wire winch, there's a common problem with worn out, breaking wire winch associated with accidents. There's the normal winch. There's the wire winch. The wire winch is one of the recommended mitigation measures. And this is a good example of how miners can also make use of harnesses to move up and down in a safe way. Next. So how do we manage occupational safety and health in ASM? So this work has suggested ways of introducing occupational safety and health in national small-scale mining. The first point to note is the compliance. OSH is a product of compliance to existing regulations, standards, and policies. Hence, the relevance of policies and the regulations which are comprehensive, which integrate occupational safety and health, as well as the professionalization of the working ethics in the sector. Then there is also risk management, as was shown on one of the slides. There is need for the miners to develop the practice of identifying hazards, determining and characterizing the hazards, and coming up with the mitigation measures. And we have suggested some of the mitigation measures in this work. And education and training is important, as will be presented by my colleague. Then there's also need for the involvement of the employee as well as the miners, because of a situation where ASM also involves the informal employment, self-employment. So need the involvement of the miners, employers, the mine workers. Then there's also need for monitoring and evaluation. Next. So on the site level, how can we enhance occupational safety and health? So this work has suggested a few steps. For example, defining occupational safety and roles for the mine owner, the managers, the workers, and there are examples given in the report as well as in the reference guide. Then on-site OSH policy, there is a reference given. We have noted that OSH is a product of compliance. So compliance to what? There are situations where there are no regulations related to occupational safety and health. So what can we do? We can also have the online on-site occupational safety and health policy, which are meant to improve health and safety on the site. And we've discussed risk assessment. Then you should also note that accident reporting and investigation is a way of identifying and mitigating causes of minor accidents so that we can prevent the major accidents. And it's also an opportunity to have records if we have accident reporting and the investigation. And in the guideline, we have also given an example of a sheet that can be used for accident reporting and investigation. And it should be noted that there are attitudes out there on accident reporting and investigation because of the fear of the police, because of the fear of penalties and the fear of the law. So this one is not meant for regulators. This is meant for the miners, just to protect themselves and to reduce accidents. So it should be made clear that this is not meant for regulators, but it's for the site for preventing and reducing accidents. Then on-site safety and health training will be covered. Then there's also self-safety talk. Then it should be noted that there is need to empower and also include women in occupational safety and health, and also to address issues affecting women on the mining sites. So this work has also suggested a continuous cycle to enhance health and safety. Health and safety is continuous. So this work is suggesting a simple cycle starts by knowledge. Literature has shown that there's ignorance on health and safety in ASM, so there's need for knowledge transfer, and the products from this work can be used for training and for knowledge transfer. So when you have the knowledge, then you plan. We have seen that we can do risk assessment. After prioritizing the priority risks, you have the mitigation measures. Then you plan. Now we are going to mitigate. Then you practice. After practicing, there are always lessons learned. You learn and you enforce those lessons, which is called ACT. Then the lessons will going to increase your knowledge. Then you can use this simple cycle to enhance health and safety in small scale mining. Next. This work has also brought application of the control measures to this small scale mining sector. We can agree that PPE is the most common safety measure in national small scale mining. You talk of health and safety. What comes to the minds of people is just the use of PPE, distributing PPE. So this work is bringing scientific knowledge, which reveals that in risk management, we need elimination and substitution controls. And the elimination and substitution controls are challenging for existing operations. They can be easier to apply for new sites. And we also know that mining is a high risky venture. It might not be possible to eliminate or substitute all the risks. Hence the importance of the engineering controls. For example, the use of wet methods can reduce exposure to dust. Then we can then introduce PPE. We cannot just introduce PPE when the miners are exposed to excessive levels of dust. So there's need to integrate PPE with the other control measures. And as far as feasible, we could also have layers of protection. We could have the wet methods. We could take breaks for the miners. We could have 8-hour shifts. Then we use PPE. So to enhance the protection of the miners, such as small scale mining, there is need for layers of protection and also integrating PPE use with the other control measures. Next. Okay. So we also have key recommendations. There's need for gender responsive OSH policies, capacity building and training, and mercury-free practices. Then there's need to strengthen regulatory frameworks. As mentioned before, OSH is a matter of compliance. So complying to what? So the level of OSH is determined by the existing policies, existing regulatory frameworks, hence the need to strengthen the regulatory frameworks such that we can come up with a comprehensive formalization which integrates occupational safety and health and can help guide the professionalization of the sector. Thank you very much. Back to Eve.
Okay, thank you very much, Josephine. Next slide, please. So in the second part, as I said in the beginning, we worked on about 24 material that we found on the internet, and this material was tackling awareness raising material, training programs, sometimes with slides, sometimes with videos. So we sort of analyzed them to see what was inside, and we make a sort of description of each material through a memo. Next slide, please, Jennifer. So we have, for each of these work, of this support material, we have done a 2-page summary, sort of memo with a general description of the project and the context. So you can have an idea if how the context is applicable to a situation that you're facing in terms of climate, in terms of type of environment, type of mining. There's a short analysis of the methodologies and approach. Also, we have looked at what is the primary audience that the training material is targeting to. So this is also interesting because some of the material is really trained for trainers. Other types of material may be directly intended to sensitize miners or to provide support for techniques for the miners or for the team leaders, for example. And then we also tackled the type of risks that are mentioned and the methodologies that are developed. So we have made a list of all the methodologies that we came across through this material, including specific topics and methodologies for gender-related OSH risks, which is quite unusual. And yes, for sure, we found that very few support documents were actually tackling this kind of topics. And at the end of each of this memo, we made a sort of short analysis of what is well developed and what is missing in each of these approaches. Next slide. So this is an example of a memo. So it's a very simple way to present things with a table. So you will have also the links to the reference studies or the support material. All the material that we have worked on is normally available on the internet, so it's easy to find. We found that there's a lot of material in English. Some of this material is also in Spanish, and very, very few are in French, unfortunately. The advantage of this memo is that it's short. You can read it. It's 2 pages, so it's quite easy to go through, and it gives you a broad idea of what you would be able to find in the documents that are available. Next slide. With this material, we also thought, well, okay, it's nice to have these memos, but what do we do when we know nothing about all this? And we want to find specific topics that are developed in such and such materials. So we made a summary table that collects all the information that is in the memos, summarizes them, yeah, and we sort of made a selection of these topics and show them through a table. So you will be able to find the type of material that is identified, the language, the quick link to the corresponding summary. So if you are interested in such topic, you will find how many of these documents are actually developing a specific topic. And you will find also there's the last column gives you an idea of what are the most frequent risks that are addressed in the support materials. And then you can select you can make your own menu of approaches and different types of methodologies that you want to develop or you may like to develop in your own project. And you can select some of these memos. Next slide. So in the quick guide, you will find that table, which is a a reference to a summary reference of each of these documents. You will have a direct link to the summaries. It will tell you what is best for and what is the type of resource. You can find presentations, videos, handbooks, guides, and so forth. So it's an easy access to this all this material. Next slide. Or you can find a more extended and detailed table, which is at the end of the document, if I remember well. And the publication number will give you a quick access to the memos, but will tell you more detail about the type of documents, like what is the primary target, the types of hazards, if it's physical, chemical, as Josephine developed them. What are the main methodologies? So you will be able to check out in more detail each of the memos and select what may be interesting for you. So that's, yeah, it's an easy way to make a quick analysis over this 24 material that we analyzed. Next slide. Our last part of the work was to say, okay, we have considerations of practices, of methodologies, but it would be nice to have real case examples and see how it worked. What is the context? What is the enabling environment that make this program successful? And what were also the gaps that were faced in some of these programs in different contexts, areas, and languages. And so we decided to work on 5 different case studies. Next slide, please. Where we could really get into a bit more depth on the project context, on the how the OSH issue was tackled. What was the kind of program that was developed? Was it training of trainers? Was it direct support on specific pilot areas? We were also we were able to look very much in more detail also on the methodology, how this is developed, what is the relationship, for example, with the official administration that is in charge of this sector, were they included as trainers, were they consulted, what were the legal aspects, and we then looked at how the outcomes of this and the impact of such training program was measured, if it was measured, but how it was measured and how we could see that it was successful. So we tell a little bit more in these 5 studies about the success stories and the challenges, and we derive from there lessons learned and how we can replicate some of these techniques, methods, and approaches can be replicable in other contexts or extended. Next slide. So the context that we have chosen is 3 studies in Africa, 3 projects in Africa, 1 in Mongolia and 1 in Colombia. First, we worked on the Somos Tesoro project in Colombia, which was a multi-year project that allowed an in-depth, really in-depth analysis and a full work with the small-scale administration, small-scale mining administration that used actually the guides that were provided to extend and disseminate a training program, which was quite interesting. We also worked in 2 other projects in West Africa, the PROMIN project in the Fair Gold supply chain in West Africa, which covered two countries, Senegal and Burkina Faso. The PROMIN project was specifically for the Democratic Republic of Congo. And in these two countries, full set of training modules was developed to perform training of trainers programs, including administration people, but also civil society and local NGOs, grassroots organization members. And this was done through different stages. One of them was to actually implement with these trainers the program on the field, which was then followed. Whereas, for example, in the PROMIN project, it was only tested in one area on a particular set of different cooperatives, mining cooperatives. With the capacity to go back a few months after the implementation of this program to see what was the impact, the actual impact on the practice change in the different cooperatives. So that was also quite interesting. And we have also the case of the Sustainable Artisanal Mining Project in Mongolia, which was a long-term project which allowed to develop a real policy in terms of a real national policy in terms of OSH and how this was developed with what were the objectives and this with the particular context of the ASM sector in Mongolia. And the last example was on the a set of training videos intended for West Africa, mainly Côte d'Ivoire, but which was very interesting because on a very practical aspect. So these videos were meant to be disseminated and were also coming along with the support of a support that was including formalization and other aspects. So this is also the context of the implementation of the OSH programs is also very important, and we analyze that as enabling factors because generally speaking, if you want to tackle this this type of issue, you also need to have organizations that are capable, that are able to actually implement, organize, and also enforce some of the rules that are necessary for this kind of issues. And I think what is interesting is that in there you see how the real experience was developed and how they ensured that some things were done and some others were difficult to actually implement because of, for example, external factors and other issues which limited the impact of such programs. So I hope I think this is the last slide. Can you? Yeah. Okay. So the main lessons learned from this part is from these studies that the training programs are very efficient when they are included into a larger set of processes, which includes formalization. Formalization here understood as something that increase and strengthen the organizational capacity and the capacity to change practices among the miners. It's also very key to address gender aspects because otherwise you're missing a great part of the target because usually you have a lot of women working on the mining sites, and it is also a factor of integration of women if you address gender aspects in the OSH programs. It's the one of the key lessons is also that it's very, very important to focus on knowledge transfer, which means empower and give really the initiative and the capacity of the miners to organize themselves and to actually identify, design the programs of risk mitigation, find the solutions, etc. So all the process should be, in fact, done by the miners themselves or the managing team of the miners. It's also very key to include strong communication and monitoring processes because communication is key. So for the miners and all stakeholders to understand what's happening and why it is important to actually address these type of risks. And the monitoring is also very key, of course, to know what you are doing. So to actually verify if all the investment in human resources, in money that you have invested in this program is useful, is you have actual results in terms of reducing the number of accidents, the diseases, etc. So, and the last point, it's also the approach that is very important to propose is to have something progressive because you cannot ask a mining group, an ASM group, to perfectly tackle and mitigate all the risk. As Josephine explained, you go first for the highest priorities. And it's also a way of having a balance between cost, priority, and safety in the OSH programs implementation. Next slide. Yeah. So end of the presentation. So thank you very much for your attention, and we are open for discussion.
Thank you so much, Yves, and Josephine, the whole team, for all the work that you did on this important topic. Wondering if there are any, I don't see any comments or questions in the chat, but we have a few minutes, or 10 minutes. So if you have anything you'd like to speak on about what your country project is doing on this topic or anything you'd like to contribute, feel free to take yourself off mute. I think, Jennifer, you can stop sharing the screen also. Thank you for doing that. I would just wanted to just share in case for those who weren't on earlier, we do have the draft.
Nosotros tenemos ciertamente
Oh wait,
un
Rodrigo, I can hear you
borrador.
in the English channel. It's okay. That's okay. Oh, it looks like we do have a question in the chat from Mauro. ¿Cuáles son los principales riesgos identificados en minería subterráneo
What
pequeña
are the main
escala?
risks that have been seen in small-scale mining, in underground mining?
Who wants to answer? I can say a few things, but also Josephine can complement. So in English, I say better, no? So I think the one of the typical issues are related to the confinement in the in the underground mining. So you have mainly ventilation problems. You have also the strength of the structures. So you have lots of collapse, rock falls, and other issues like that. So you have a ventilation issue, but you may have also electrical issues because usually you light your underground structures with electrical wiring, and you may have also gas related issues, which also relates to ventilation because underground structures tend to have gas emissions, which some of them are very toxic. And so sometimes it's necessary to test what kind of gases are present in the underground structures because you face the risk of asphyxiation. And one of the other risks that are very common is the flooding of the underground structures, which can sometimes come very quickly if you have a water vein that fills up the structure quite quickly. Yeah, and so it's really related to this kind of risks. But maybe Josephine, you can add from there.
Okay, thank you very much, Chief. We also, you have mentioned the majority of the risks. In addition to what you have mentioned, I also wanted to add the oxygen levels. Because of the poor ventilation, there are also challenges with the oxygen levels and temperatures. High temperatures are also one of the challenges, such that in some contexts, the miners who are working underground have confessed that they cannot work with PPE because it's too hot. It's too hot underground. And on some mine sites where the mine owner insists on PPE, there's one report in Zimbabwe, the miners would go underground wearing PPE. When they get down, they remove. They say it's too hot. So high temperature also affects the compliance with the use of PPE. And there's also the issue of natural gases underground. Thank you very much.
Thank you both for that. Just wanted to also pull up a question that was, what specific measures are applicable to women? I guess to the women miners, I guess. Is that right, Deanna? You can come off mute if you wanted to elaborate on that question.
Hello, Mona. Hello, everybody. Yes,
Go
my
ahead.
question is related to specific actions that we should suggest to women.
Women are they face specific risk because they are assigned specific tasks. Since usually they don't have access to all of the different roles that you can play around in the mine. They focus on specific tasks, and so they have a very specific exposure to risks. For example, in some areas they do a lot the mercury amalgam burning, which enhances the risks for them, especially when they are pregnant or when they have children along with them. But they also may have issues related to the access to the personal protective equipment because it's not adapted, or they will be working in specific environments because, for example, they work only on tailings, so they have specific risks related to that. Women have also a specific risk because they have a sort of double burden. They work at the mine, and at the same time they take care of the household, so they have long days. They sometimes need to bring their children at the mine, things like that. And of course, they face very specific discrimination risk or violence related risks because of the sexual harassment, gender, sexual based risks. So these are very common, but they are usually not tackled as occupational health and safety risks, although they are, because it's really the working conditions that are at play here. So yeah, maybe Josephine, you want to add a few things on that?
Thank you very much, Yves. Thank you for the contribution. I have a few things to add. So women in small scale mining, they are also faced with the violence, gender-based violence. Then if you look at sanitation and hygiene, the lack of toilets on site is an issue for women. Or we can just have one pit for both men and women. It's an issue for women and the sanitary conditions. So women are also threatened by poor sanitation and hygiene on the mining sites, and which has revealed that the participation of women partly affected by the sanitation and hygiene on the mining sites. At the same time, there's the issue of women occupying peripheral roles when they are working, which is also associated with the low remuneration, which compromises their capacity to own their own PPE. At the same time, they are not in decision-making roles, such that when the organization is discussing occupational safety and health issues, no woman might be involved. So their voices might not be heard. And there are also other social issues which might not be specifically occupational safety and health. If they are occupying low-paying roles, the women, then they can be taken advantage of by men, which can translate into things like exchange of sex for money. So women will become more vulnerable. Okay, thank you very much.
Thank you, Josephine and Yves, very much. And just to end on a few things, there was a comment in the chat from Molin, I think, if I pronounced that correctly, or apologies if I mispronounced that, just to commend efforts to consider gender differentiated exposures to hazards, valuable in Zimbabwean contexts where women's involvement in the ASGM has grown from about 10% in 2022 to over 30% over the last 2 years. That was an important comment to bring up, especially March 8th is International Women's Day, but we should acknowledge women every day, I think, not just the 8th of March. And I just want to say thank you to everybody who was able to join. We will be circulating the recording and the presentation. Once again, if you weren't able to join in the beginning, we do have draft internal documents or materials that were mentioned on this call. I'll put the link in the chat again, and I'll circulate it once we have the recording. Once these are finalized, we will notify everyone so that you can circulate outside of the program. But thank you so much for joining. Thank you to the interpreters and to the presenters and to all of you doing all the work in the field. Thank you.
Okay, thank you.
You, Mona, thank you.
Thank you.